So I'm going to show you just the tiny little exercises when I'm in spasm and I'm in pain that I do regularly, maybe 3 or 4 times an hour, to just make sure that I don't get too stiff, too locked up, and that when I need to get up and leave a chair or get up from the table or something, that I can. And so many clients come to me and say they've got back problems and they've had physio in the past and it hasn't worked. And when we dig down, and I'm not saying this is everybody, but when we dig down, it's because they've been given these little exercises, but they've not done them. And I think sometimes they feel so little that you think, how can they possibly work? But when we're talking about back pain and Pilates for back pain, what we're doing is just reminding the body how the back works and how the rest of the body can support the back and the centering and core muscles in doing their job. So these little exercises are really important. If you find yourself in pain or feeling stiff and just at that point where you're just about to panic about it, touch back in with this video, and I'll try and store it on the group because I think it's quite an important one. And just try these little exercises. So I'm going to show you them. I'm going to go down onto the floor and show you them. If that doesn't work for you, you can do a lot of them in sitting as well, and maybe I'll show you some in sitting in a little while. Okay, so I'm going to just come down onto the mat, and I know this doesn't come easy when we're in pain, but it is really nice for the body, and it's also really nice for the breath. And I think when we're down on the mat, we can feel our breathing muscles and the width and the depth of our rib cage really nicely, because you've got some feedback from the floor. So the first thing I'm going to try and do, and I did a video on this a couple of weeks ago, so go back and watch that, but is just to check in with my belly breathing. So first of all, just check in with my belly breathing. Try and create a sense of calm in the body. And if you do nothing else when you're in pain and spasm, then do this, because it tells the body that everything's okay. And like I said, my previous videos, if they've gone from the group, I'll store them as well because it's so important. Lovely. So I've checked in with my belly breathing, I've connected my mind and my body, so I'm telling myself just to feel how I feel on the floor, however that is, whether you're stiff, whether you're hitched, whatever it is, just feel the way your body feels on the floor, and then try and sink into it. So try and sink into the floor. If you can't get onto the floor, then you can do this on the bed or on the sofa, wherever you are, and feel a sense that whatever's underneath you is coming up to take the weight of your body, so you're feeling lovely and free. And then just lovely small movements. Now I always try and start just by releasing my neck, because I get really tight in my neck. Just dropping my chin and then lifting it up. Just a little bit of mobility. And then I start drawing my shoulders around or lifting them up, taking them down. Again, my stiffness was in my lower back, but I just like to move where I can. And then hands behind my head, and I'm just going to drop my chin and just come up into a curl up, just a really low curl up. So I'm not using muscles to the point where I'm gripping or causing any more tension, but I'm just mobilizing the pain-free part of my spine first. And I'm reassuring my body that this part of my spine doesn't hurt to move. So that's one thing that I always do, just to give my body a little bit of confidence. Okay, and then I just get comfy again. And then I go on to my baby spine curls. Okay, so I'm going to put my hands across my chest so you can see my hips rolling. And I'm just going to tilt my pelvis towards my nose and then send it away to my toes. Now, around here gets really painful for me. And when I am in spasm, my extension, so as I roll my pelvis away, you go into a little bit of extension of the spine. That's always a sore area for me. If you come to my classes, you know that I often leave the extension out after a couple of demonstrations, because it really isn't my friend sometimes. If it works for you, send your pelvis all the way to your toes and then curl up to your nose. And just like anything, if what I suggest doesn't work for you, then listen to your body, do what works for your body, but just try and create some mobility. And then as I become freer through the lower part of my spine, I just start to mobilize a little bit more. So that's just a little bit of mobility. Then when I've done that, put my hands on my hips and I just try to drop my hips from side to side. Now here, this is about mobility. This is just about reassuring my body that I can move, that it's safe to do so. I'm not worried about when I breathe in and when I breathe out, but I am breathing deeply, trying to get that belly breath in and just keeping the body calm whilst having a little bit of mobility. And then as that mobility increases, I tilt the pelvis and I just start to roll the knees. You'll see I haven't connected them like I would for a hip roll because I'm just trying to be free and easy and just create a little bit of safe mobility. So I'm tilting the pelvis to one side and then just drawing the legs over slightly back to the middle. And it's just like a little rocking action. I'm not using my breathing as speed. I'm just doing what I feel comfortable with. And probably it's a little bit quicker than more normal Pilates moves because I'm trying to create some mobility and some lubrication in those areas. And then what I do is I rest in the middle and I bend one knee and I just give it a hug as much as I can if that feels comfortable. And that feels comfortable in that side for me. I'm still a little bit stiff. This side isn't as comfortable. So just go with whatever your body feels like. And then when I've done that a few times, I will try and connect them, draw them up and give them a bit of a hug and just draw them in, keeping my head on the cushion, hugging my knees. That can really stretch out your lower back and then draw from side to side. And if you're struggling to get into rest position, which we do a lot of for releasing our lower back, this is almost like rest position, but lying on your back where you might feel a little bit more secure. I can really feel that deeply today. And if you're free and easy for movement at the moment and you're not in any pain, you might think, what the heck's she doing that for? But when you are spasmed and you are really stiff in your lower back, this can just be a lovely release. And as you can see, I sort of squeeze it on, release it, just giving myself a little bobby hug here of the knees, and then just a little roll around, a little massage at the back of the pelvis. So that is just what I do 3 or 4 times. I'm always careful how I get up as well when I'm in the spasm. Just a little roll around. And to do that in sitting, I'll go to the side so you can see some of those exercises. If you're not comfortable getting down, this is really nice, just rolling the pelvis in sitting. Again, not really worrying about anything else. I'm just letting my pelvis move around my lower spine. And then of course you all know how much I love a bit of rotation to just loosen off any spasms as well. So there you go. I just wanted to drop in with that because that's my favourite little session that I do. I haven't had a spasm like this, if I'm honest, in quite a few years. Last week was a real punch to the face. I had a really bad cold, really bad cough, wasn't breathing too well with my asthma, completely lost my voice and my back went into spasms. So this week feels like a gift. It's free and easy and everything's better. So I hope you are fitter and healthier than I have been. I hope you have a great week, and please feel free to drop in with any questions you have, and I will put a little link to that Headspace app that I told you about. Okay, take care. See you soon. Bye.